Ever wondered about the safety of certain drugs during pregnancy? Today, we're going to break down the FDA's categories for drug safety during pregnancy. This is a topic of paramount importance because the medications we take can affect our bodies on a microscopic level, influencing processes like cell division, replication, and even DNA mutation. It's crucial to understand that drugs taken during pregnancy don't just affect the mother, but can also reach the fetus, potentially causing harm. This is why professional medical advice should always be sought during pregnancy, no matter how minor the health concern might seem. So, let's delve into the FDA's classifications for pregnancy-safe drugs. There are 5 categories: A, B, C, D, and X. Category A. Drugs are considered safe throughout pregnancy, with no known risk to the fetus, even in later trimesters. They include many vitamins and medications like levothyroxine for thyroid disorders. Next, we have Category B drugs. These also show no risk to the fetus or the mother, both in the first trimester and later. Examples include acetaminophen for pain and fever, and amoxicillin, an antibiotic. Then we have Category C. Drugs under this category have been shown to have some potential adverse effects on the fetus and mother. They should only be administered if the benefits to the mother outweigh the potential risks to the fetus. For Category D drugs, human fetal risk has been documented, but these drugs may still be used if the benefits to the mother outweigh the risks to the fetus. This decision, however, should always be made under the supervision of healthcare professionals. Finally, there's Category X. These drugs have been found to cause life-threatening adverse effects in animal trials and are contraindicated or not recommended in pregnancy. Remember, when it comes to medication during pregnancy, it's crucial to seek professional advice. Let's dive into these categories to get a better understanding. Let's start with categories A and B. These are considered the safest drugs during pregnancy. Category A drugs are generally benign, even in later trimesters. They often include vitamins and levothyroxine, a medication for conditions like hypothyroidism. Moving on to Category B, these drugs have also demonstrated no risk to the fetus in the first trimester and in later stages of pregnancy. Common examples include acetaminophen, a pain reliever and fever reducer, and amoxicillin, an antibiotic used to treat a variety of bacterial infections. It's important to note that while these categories are deemed safe, they are not a green light for self-medication. Each pregnancy is unique, and what works for one person might not work for another. Therefore, it is always advisable to consult with a healthcare professional before taking any medication. So, Category A and B drugs are generally considered safe during pregnancy. But remember, always consult with a healthcare professional. Now, on to categories C and D. These drugs require careful consideration and professional guidance. Let's start with Category C. These drugs have shown some adverse effects on both the fetus and mother in studies. Examples include diltiazem, used to treat high blood pressure, and spironolactone, a diuretic. They're not to be taken during pregnancy unless the benefit to the mother significantly outweighs the risk to the fetus. Moving on to Category D, the situation becomes more critical. Evidence of human fetal distress has been documented with these drugs. They include phenytoin for controlling seizures and valproic acid used in treating certain types of seizures and mood disorders. These drugs may only be used during pregnancy under strict professional supervision, and only if the benefits to the mother are deemed acceptable despite the risk to the fetus. While Category C and D drugs may pose some risks, they may still be used under professional supervision if benefits outweigh potential dangers. Finally, we have Category X. These drugs are considered high risk during pregnancy. They have demonstrated life-threatening adverse effects in animal trials and are therefore contraindicated during pregnancy. A prime example is thalidomide, which historically caused severe birth defects. Warfarin, a blood thinner often used by heart attack patients, also falls under this category. To recap, we have Category A and B drugs, which are generally considered safe during pregnancy. Category C drugs may pose some risks and should only be used if the benefits outweigh the potential harm. Category D drugs have evidence of fetal risk, but may still be used under professional supervision if necessary. But remember, each individual is unique, and what works for one might not work for another. The effect of medication depends on various factors including dosage, genetic and physiological status, and exposure to other drugs or environmental hazards. So, there you have it, a general overview of drug safety during pregnancy according to the FDA. As always, seek professional advice before taking any medication during pregnancy.